students on the call know me. I'm Taiguchi. I'm one of our co-directors of the medical student education. And, we've been trying to do these little town hall meetings where you can learn more and more about our program. So this is our third session. And I feel very fortunate to have Dr. Granville Lloyd presenting. He, along with several of the other faculty from the VA, I believe I saw Dr. Sawyer on there. Dr. Steinberg may or may not be on. And then one of our newer faculty may also be on. But again, this is your opportunity to kind of see our program, what it's worth from the different eyes of the different attendings. I think in addition, certainly everyone on the call is more than welcome to join us for our Grand Rounds educational sessions. And then also wanted to have you guys reminded, we still have a couple more of these sessions coming up, including Denver Health, which is our county hospital with Dr. Donalicio. And then at the end, again, we're going to have like an open forum with all of our fourth year medical students, also called acting interns. So you can also get a look through their eyes of what they saw while they were here. And maybe while, the attendings weren't there as far as what's being done for patient care and in the OR. So with that, I'd like to introduce Dr. Granville Lloyd. He is a true colleague and a truly great addition to our faculty a few years ago. He actually won the Medical Student Educator of the Year last year. We were very fortunate. He's gone on to really, really mentor several medical students. So he's going to give you guys an update on what's going on at the VA, including discussing, the current state-of-the-art VA that was built a few years. It took over a decade, but they finally moved in there, and it's pretty phenomenal. So go, Dr. Lloyd, it's all you.
Thanks so much, Ty. That's incredibly nice of you. Thank you to all of you that are joining us today for this town hall. I intend this to be a very roundtable discussion sort of topic. We'll go through relatively succinctly all the features of the VA, and I am going to do my best to convince you that this is the best VA there is, and we provide one of the best VA experiences we can. There's no debate that this is one of the best VAs or the best VA in America by at least one metric, and we'll get to that in just a moment here. But welcome very much. Let me get started by enlarging this. Okay, is that projecting full screen for everybody? Cool, all right. So I'm the site director for the VA. And again, to kind of try to cast this in a bit of a framework, I submit to you that there are only three things that you really care about in residency, and not even necessarily in order. They are, number one, are you going to get good training? And we'll talk a bit about that. Number two, are you going to have the opportunities that you seek after residency? Will you be able to get the job that you choose? Will you be able to get the fellowship that you choose? And thirdly, and this is important and a little bit harder to answer, will I be happy? One of the true strengths of this department and this program is not only that we provide absolutely top-tier training, and it's my pleasure to speak to the VA part of this. I think you've heard about the university, children's, and Denver Health portions. They are all an amazing dovetailed set of puzzle pieces that come together really well. But I think even more than that, or at least every bit as much, as the culture of excellence, the culture of teamwork, the corps d'esprit, and just the everybody working very hard, which I won't kid you, we do, and the residents especially do, but also being very happy. I'm going to let some of the pictures speak for themselves, and that's actually going to be one of the bigger thrusts of this, because I think everybody tells you, hey, we do robotics and we do amazing stuff, and that's going to be relatively true everywhere, although there are differences. But the culture of resident excellence is a very unique and specific thing that I think this department has done a really good job of creating. So a couple details about where we are and what we do. We practice at the Rocky Mountain Regional VA, pictured right there, and it is the 26th most expensive building ever constructed on Earth. Which is kind of hard to wrap your head around until you think a little bit about some of the factors that go into building a large governmental entity. This thing came in at $1.7 billion, and I will tell you, it is very nice. The physical structure that you're located in, and this is, I should add, on the Greater Anschutz campus. Just in the distance of this image, you can see where the University Hospital is, and you can also, in between the two, see Children's Hospital, immense amounts of research buildings, libraries, gyms, you name it, it's all there. But, you know, the physical structure does add something. The budget for equipment does add something. It's amazing, nonetheless, how much this spent, how much this costs, so much so that you might ask, what else could $1.7 billion have gotten you instead? As opposed to the Denver VA, you could have gotten prima donnas, overpaid semi-professionals, high cost of admission, a debatable track record of success, jaded locals, all these things, and you would call it Yankee Stadium. A little tidbit for all the sports fans out there. I hope there's not too many Yankees fans, but it gives you a sense of the size and scale of building that we're talking about here. So the best things, that said, and that aside, than the building itself at the RMRVA, the best things are the staff, undoubtedly the residents, and I'm just going to keep coming back to that. The facilities are great. The opportunities to learn are almost literally endless. We have simulation, we have research, we have some really cool technology. We excel in HOLEP, we have an aquablation program, and we have enormous autonomy. This rotation, the resident experience, which occurs at 3 levels, PGY1, PGY2, and PGY5, the chief year, is crafted to provide an enormous amount of resident autonomy. We want the senior residents teaching the junior residents. We want the junior residents teaching and working with the medical students. And I think the pieces have really come together very nicely to create a good, gratifying educational experience. And the chiefs, when they're graduating, are universally and across the board at the Teach One stage beyond C1 and Do One. The other best things about the VA that we have, the food, we'll touch briefly on that. It's important. You're going to need to eat. It's located in Denver, which is one of the coolest cities, I submit, in America. If you haven't been here, you should visit, even if we don't have the fortune to attract you. It's located in Colorado, which is a spectacular state in loads of ways. I think the pictures that we're going to go through are a little bit oriented towards outdoor pursuits. But I would not want to miss the restaurants and the art scene and all the indoor pursuits that are available here, especially once we get to stop wearing the masks, hopefully in the next year, by the time you guys are really settling in. And again, the best thing about the RMR are the co-residents that you go through this whole experience with. And again, that just speaks to that culture point. This picture was from the opening day ceremonies from the RMR VA. Quick spin through the faculty here. Mark Sawyer, fellowship trained in urology and general urology. He's the chief of urology. He's the mastermind behind all the excellence that you see occurring here. And our resident stone guru in addition. Steve Steinberg, many years of private practice, has been an invaluable resource to all the residents just in counseling in terms of where do I go next? What do I want to do? What should I think about? And brings huge amounts of experience to the table as well. That's me on the left. I'm fellowship trained in robotic surgery, and I do a fair portion of the cancer that comes through. And our newest faculty member, Dr. Eric Ballanlanda, just joined us from University of California, San Diego. We're super excited to have him. And he's going to be doing not a little of everything, but instead a lot of everything. Here's a gorgeous picture of what 1.7 will get you. It's a really remarkable physical structure that we have the pleasure of practicing in. This is one of the main hallways. It's sort of like, it kind of reminds me of one of those arcing views from the Death Star in Star Wars. Here's a picture of our team. I have a couple more. This is not the whole team, but this includes a couple of the OR staff, a few of our PAs. We're happily supported by 3 really excellent, soon to be 4 physician's assistants. And every single one of them is fantastic. 2 of them thus far function as robotic bedsides in the operating room. And that's really been a great step forward. That has kind of taken a lot of the pressure off the junior resident. So instead of sitting there holding a sucker indefinitely, not that it doesn't have educational value, but it can take a lot of time. So instead, we have the junior residents in the adjoining room pounding away, doing TERPs, doing stones, doing complex ureteroscopy, doing all the bladder tumors, of which we have a few, the scrotal cases, and all the things that they can themselves do, hopefully with a high degree of autonomy and independence. Let's go through some of the details. I don't want to belabor this because I feel like we'll come back to it. And I also think that you guys hear a fair bit about this at many of these town halls. First of all, robotics. These are all pictures from our operating room. We do a lot of it. It seems to be a recurring question. For trivia, if everybody can identify every one of these cases, that'd be super. But these are all screenshots from robotic cases that we've done here at the VA. And it really does run the complete spectrum of everything in robotic surgery, from spermatic cord denervation to upper tract reconstruction. There's a reimplant up there, intracorporeal bowel work, simple prostatectomy, radical prostatectomy, partial nephrectomy, of course, you name it. The one thing that we don't do is intracorporeal neobladder. We do the conduits, but not the neobladders. Good news, you'll get loads of those with Dr. Kukreja at the university, so you won't feel too cheated. Secondly, and a common question is, will you get a good open surgery experience? And the answer is yes. Now, I won't lie to you and say that we're going to be doing open prostates, because we're not, or we're certainly not planning to, although we can if necessary. But cystectomies, I give the chiefs the choice of how they want to do their cystectomies. And for example, we have coming up one in 2 weeks. And our current chief, Dr. Luke Bidikov, said, hey, let's do this open. I'd like to do it open. So bam, it's an open cystectomy, and he will be taking the junior through it. And I will be expecting that I'll be answering a couple emails, having a cup of coffee, and quietly cheering him on. As an example of the degree of synergy and chief leading junior surgery that we accomplish, one of our recent graduating chiefs, our just most recent chief, which is why I'm thinking of it, did a post-chemotherapy, post-checkpoint inhibitor, I should say, cytoreductive nephrectomy after a really large renal mass had become operable. And those are not easy cases. And he took our junior resident, that's the picture on the left there, right through the entire operation. And we just kind of stand around and cheer. One of the other graduating chiefs not too long ago did a cystectomy. And just to kind of check him, again, skin to skin, all by himself, taking the junior resident through it, I was able to compare his metrics in terms of blood loss and time to the RAZOR trial, the big, best of the pros comparative series. And it took him 1 hour more and I think 100 cc's blood loss more than the average of all the true specialists participating in one of the biggest multi-center trials. So this is the degree of excellence and expertise that you should expect to have and be active in passing on to your junior residents before graduation. We have some really unique opportunities that I suspect many VAs and I suspect many programs don't offer. Holmium laser enucleation of the prostate is one of them. This is one of Dr. Sawyer's specialties. This is sort of a graphic depicting how it works. And we're not here to talk about urology specifics today, but essentially it's using a laser to enucleate the adenoma from a prostate, much like a simple prostatectomy, except done with a laser. Really cool operation, really great opportunity to, again, not just learn, but actually do these operations. Different sort of procedure that we're currently experimenting with, we do aquablations. And we are actually the first place in the state of Colorado, public, private, academic, you name it. We're the first place, and I think still the only place that has succeeded in getting the program together to do this. Really neat new cutting edge technology. So whether this goes on to become a gold standard or become one of the myriad also rans in the BPH technology game, we'll see, but it does make well the point that we are doing absolutely the latest things, and we're working very hard to position all of the residents such that they can move forward down any literal direction that they choose to. Beyond that, as noted before, we have loads of cystoscopy, endoscopy, flexible ureteroscopy, laser. We have a high-powered laser for upper tract cases. We do prostate biopsies. Yes, we do. We do MRI-guided biopsies. We have one of the fusion devices that allows us to work with our radiology colleagues. We have a dedicated MRI program. We've worked to get an MRI multi-specialty meeting together, and it's been difficult to get the horsepower in one room. But we have a wonderful collaborative relationship and great potential to further grow that. We have simulation in the endoscopic domain where we can simulate and practice many different aspects of surgery there. We have simulation in the robotic domain with the backpack and one of the Da Vinci's, and it's also possible to come in after hours and craft anastomotic simulators, practice sewing things, practice piloplasty, all these kind of things. And finally, we have a renal mass work group, which is another multi-specialty initiative that we have, where we work with the interventional radiologists, review those 2 centimeter, 3 centimeter, 3.5, 4 centimeter masses, perhaps even larger in the highly comorbid patients, decide the best form of treatment, and then we follow them from there. So we look at a ton of images, discuss the data, discuss the treatment options, and these are all structured in an educational format. There's more conferences and meetings beyond this. We have a medical student talk every couple of weeks, which is just kind of fun, and fun for the students, fun for the residents, fun for the staff, frankly. So it's a very diverse experience we have at the VA. We have research. These are a few papers, publications, AUA podia. We had 3 this year from the VA at the AUA podium. The picture on the left is actually a pig. One of the medical students and I did some simulation in this pig cadaver, or sorry, not pig cadaver, live pig that was used by general surgery. And then we were able to go use the bladder, and we did some kind of math experiments in terms of the amount of tissue required to create Boari flaps. ICG angiography was kind of a fun little thing. One of our residents, Dr. Halstead, did. Dr. Antoine presented, and we're submitting the paper at the top right. It goes on. There's plenty more than what's here, but there's a load of research opportunities at the VA, and we're ever continuing to expand those, because it is true, you go home from the VA probably a bit earlier than you go home from the university on average. All that said, that's the background, and I don't want to beat any of those horses to death anymore. We can come back to those in questions. But I want to submit to you that the thing that matters the most to your happiness, it is getting good training, and you do want to be very careful and sure about that. You want to make sure that you're on the arc that you need and want to get to where you're going. But the people that you work with make an enormous difference. The satisfaction that you have at the end of a really long, hard day of doing whatever you did, and then going to spend a couple time with your friends and coworkers, and whether you have a beer, a glass of wine, go to a show, go to an opera, go for a run, play basketball, these things really matter in how the days and the months and the years go by. And you will form, as many of us did in our residencies, friendships that will literally be lifelong. People that you'll see at the meetings for the years to come, people that you'll see, perhaps in your own practice for years to come. So from there, I'm just going to spend a little bit of time showing you a few pictures. The residents found it extremely easy to share with me a variety of pictures of them doing some of the fun things that Colorado has to offer, that the outside environment has to offer. We have a resident ski day. There's a few pictures from that, but this is a bunch of the residents, somewhat unrecognizable because I think it was cold there. Skiing and frolicking and possibly having one thoughtful cocktail at the end of the day afterwards. Some hiking pictures, hiking with significant others, with children. These are a couple of our residents there. Another one of these pictures on the left that I'm going to let just sort of speak for itself. Dr. Marks, one of our excellent chief residents on the right, doing a little simulation and clearly enjoying every second of it. Basketball. I kind of enjoy this picture. I'm not a basketball player, but it was exciting to see that 2 of our residents were able to get the landing gear completely off the ground. I mean, I think there are 2, maybe 3 inches in the air there simultaneously. That's kind of good to see. Staying in shape. Good work, guys. Another lovely picture. We have everybody from a couple of the then interns up through our one of our incoming chiefs, Dr. Islam, on the left there. More ski pictures, a lot of ski pictures, a lot of camaraderie, Luke Bidikov, another one of our chiefs. I just learned, a little bit to my surprise, Luke actually skins and tellies. I did not know this. That sort of exemplifies his days on the left, pushing through the deep snow slowly into the distance. And then on the right, the payoff, that's him again, I believe, skiing some fresh powder. Dr. Xavier, one of our newest interns, now second years, doing a fantastic job out there in the great wilderness on snowshoes. Luke again, Dr. Szymanski, bottom right, another one of our new second years, and just more frolic, Dr. Pessoa, Dr. Halstead. So I think, and I threw in a couple of the attending photos here. That's Dr. Sawyer in the orange jacket, Dr. Flynn from university, and me there on one of the resident ski days. We go as well whenever the opportunity is available. And Dr. Ballanlanda on the right there, skiing in Japan, glamorously enough. A couple short words about Denver, and then we'll just kind of move on to the question, so forth thing. Denver, Colorado, I grew up near here, about an hour and a half north, relatively small town. When I was a kid, Dr. Iguchi grew up here as well. Denver was reasonably cool, but whatever. Denver lately is so cool, it's really hard to process. The food scene is remarkable here. The music scene has always been fantastic. We'll come back to that in a couple quick pictures. Just the general social scene, the number of things going on, the number of events of any variety that you could imagine happening on a given Tuesday night is just endless. There was a Monet exhibit that came through the Denver Art Museum recently, the only place in all of North America, not only the only place in the US, but the only place in Canada and Mexico that the Monet exhibit went was Denver. 146, I think, Monets. And I went and saw it. It was absolutely amazing. So the art scene is blowing up. A lot of people are moving here, and it's really a remarkable city. I took this picture myself from one of the supported baseball games, not supported, but it was just a Department of Surgery baseball game that we all got to go to. And this is what it looks like every day. It's pretty beautiful. There's a restaurant near me. Again, the food scene is just ridiculous. You will never see this place empty again. It's a complete zoo right now, with lions outside and all the COVID precautions making it kind of tough. Red Rocks, you may have heard of it if you watch music at all. Unfortunately, it doesn't look like this right now, but it will again soon. And it's just a beautiful place, not just to go to see concerts, but they have a lot of different forms of events there. Lots of small venues. Again, just a really literally endless list of things going on in whatever entertainment domain that is of interest to you. Here's a different picture, which I didn't take. This is from Red Rocks again. Right now, one of the things they can do that's appropriately socially spaced for the COVID things is have yoga. So every weekend they're having this giant amplified yoga thing at Red Rocks, which I've been to before, although not recently. It's really pretty remarkable. It's just a cool place to go. Other scenes of Colorado, these are a couple of my own last weekends, a little camping, a little biking. We showed so many ski pictures. I wanted to put in something that just wasn't ski. But the state outside of Denver, same thing. It's just limitless. If you want to go to small towns and see what's going on, if you want to stay in Denver and experience the big city stuff, college towns, you can go to Boulder, you can go to Fort Collins, you can go to Colorado Springs, you can see the Air Force Academy, you can ride the trains. There is an endless amount of things to do of every variety. And people come visit. Picture on the right, is Brad Erickson from Iowa, Phil Prazio from Hopkins. We were all up on the summit of Highland Bowl in Aspen for the Aspen meeting there. And finally, my last slide, just kind of reviewing it, because food is important, even on a day-to-day basis. These are all the food. This is not all. This is a representative sample of some of the food that's available right near the VA. The most shocking thing of all is that there's actually good sushi in the VA. And that picture of that guy, he's my buddy. I come down to lunch and he makes me these salmon bowls all the time. But he's right there cutting up genuine, safe, raw fish. And it's kind of shocking that you can be at the VA and just meander down the hall and get some good sushi, get some rolls, get whatever you like. All these other places are literally right across the street. We walk over there. I'm a little obsessed with Nom Nom myself. It's kind of delicious. But there's more even than this here. So you can stay nourished even at work. Another picture of the team pre-COVID, obviously bad Christmas sweater situation there. The final point, and this applies to every VA, the greatest thing about the VA is the veterans. Anybody that looks at this picture, this is also from the opening ceremonies, and doesn't want to just go spend some time, take these two home, hang out with them, do an artful terp on that gentleman, and just make his life a little bit better. If you don't feel that way, then you may wish to reconsider urology. If you do feel that way, there's loads of these guys. They're the world's most adorable patients in an absolutely wonderful setting. And honestly, it is a true pleasure and a privilege to take care of these folks. So without too much more ado, the summary, again, those are the things that I think, that I would submit should matter to you on this interview trail. Are you going to get good training? And is it going to get you the opportunities that you seek? And we can discuss the granular details of what you think that means, but I would submit that our VA and our rotation contributes substantively to it. And finally, are you going to be happy? I've tried to convey more than any other thing the culture that we have here at the University of Colorado and at the Denver VA. I think it's as good or better than literally anything. And I submit strongly that the answer to all three of these questions for you will be yes. And without any further ado, I'm going to stop sharing. I know Dr. Sawyer's with us here, and I'd like to open this up to any questions, roundtable discussion that any of you may have.
So I'd just like to start by saying that just a great summary and overview. And so thank you to Dr. Lloyd. One of the things that we do really prize ourselves on our education, our educational activities, and just the variety of things that can be done. Just to reiterate, Dr. Lloyd received the Education Award from the medical students, and Dr. Steinberg received the residency Best Faculty Educator Award this year and multiple times in the past. And so I think we're all very proud of what we've done, not in terms of patient care, but also our education. So, so if any questions, we're both, as well as Dr. Ballenlander, our newest recruit, is on the call, and happy to answer.
I can't see the chat room, but certainly if you don't want to come off mute, you certainly could put the chats in. And then, what we've done kind of historically for these is certainly have the faculty answering their questions from the students that they have, and usually we'll pop off. We have a whole gaggle of residents on that we could certainly let them answer specific questions about their VA experience.
I know we had a few questions sort of pre-phoned in regarding a few of the things that I tried to cover a little bit there. The autonomy thing I can't overstate. That's really one of our goals, is to throw y'all in at least the medium deep part of the pool and let you paddle around a bit, but not too much. And we really, try to support that as much as we can. I've got a chat question here, balance of OR to clinic days per week. It's in evolution, and it's a great question. We have 2 full main OR days per week. We have a couple add-on and minor procedure room OR days per week too, and those 2 days, one of them we have 2 rooms all day, so there's 2 people operating simultaneously, 2 attendings, I should say, in 2 different rooms, a junior in one room, a chief in the other room. We have another day that's 1 room and frequently minor procedure. We have add-ons. We have a lot of cysto clinics, and it's a great opportunity for the residents to feel very, very confident with the office-based efficiencies and accuracies of doing cystoscopy, doing vasectomy, doing prostate biopsy, doing MRI fusion prostate biopsy. So it varies a little bit by time. The VA ebbs and flows to some extent, but that's how it stands right now.
Just to add, we do about 500 OR cases a year, and about 1,200 procedures in the clinic, and we're anticipating probably close to doubling that. We also, I think it was mentioned, we recently had a new spinal cord center of excellence that was opened, and that's a huge opportunity for urodynamics and really getting to know and understand neurourology. I think that's another big opportunity. So our catchment area, similar to the university, goes up to Montana, includes Nebraska, Kansas, down in New Mexico even. So it's just a huge geographical area and a lot of patients. So we're super excited about that growing part of our practice as well.
Thanks so much for the talk. Could y'all talk a little bit about some of the research that's happening at the VA?
Absolutely. We have a couple IRBs. Dr. Sawyer has an IRB looking at patients based on hematuria and pursuing many of the factors associated with that. I have an IRB looking at the cellular and genetic characteristics of large prostates, very large prostates. So those are a couple of the sort of basic science and hopefully translational things that we're developing ever more all the time. We do a lot of database research. One of our medical students was able to present a few things in podium format at the AUA this year based out of that, as was one of our residents. BPH for me is my primary research focus. We do have some other projects going on at the same time. We do some robotic-based, we have some surgical technique video that's going together right now. So there's a spectrum of things. The thing that I think is pretty cool, between the four of us, we can support just about anything, you know, so anybody that comes in with an interest, we can support. The resources of the university as a whole are just endless. I honestly get more emails than I can read in a given week or month from the Centers for Innovation and Development, from the statistical cores, from all the different sort of things. And every time I've reached out for a collaborator, it's been very, very easy to find one. So the beauty of being on the Anschutz campus and part of the university is that you can, as you should, develop a research thrust, hopefully as early as possible. And we actually try to use the VA as a springboard to get people involved early on and leveraged into further publications and some somewhat longitudinal research over time, because there is more time at the VA. Like, there's just no debating that. So, there's a lot of things that are going on at the VA specifically. There's even more things that are going on at the university as a whole. And whether you do something that's connected with us or whether we help you get connected into something at the university, there's an almost endless ability to meet any interests or needs and to develop them.
Yeah. Just dovetailing on that, we do have a big opportunity in terms of numbers. I mean, just in the VA, we do over 20,000 PSAs a year. The IRB that I have going back 25 years has over 500,000 urine studies. So you can get big numbers really quickly with retrospective or even prospective studies.
Hi, this is Thompson from Loyola, Chicago. So sounds like the urology department overall it's doing pretty well at the VA hospital. How would you say the interaction between staff, OR members and other departments are at the VA?
I think they're fantastic. I mean, the people that we get to work with are part of what allows us to have the success that we've had and to do the cases we do. We have a dedicated, and I can speak a little bit more to robotics, but we have dedicated both robotic staff in the operating room and also dedicated staff that takes care of the majority of the non-robotic cases. And they're great. They're fun. They're just a wonderful team to work with. We periodically periodically, I think, all hear stories of places where it's not like that, and you know, a little bit shake our head. We, you know, right or wrong to that same point of culture, we've just got a great culture of let's go get things done. Now, you know, I'm not going to lie to you and say that, you know, we love it when they shut us down at 3:30 in the afternoon or at 5 in the afternoon, because we don't. And it is the VA, and there's parts of that that just you can't, you know, pretend isn't the case. But we get along really, really well, and it's a very collaborative, it's a very collegial environment. So it's great. I mean, I enjoy going to work. I enjoy going to the operating room, and it makes me happy. Well, anybody else, any other questions, anything else I can tell you? I can make a couple summary comments here, but jump in if you think of anything. If anybody wants to reach out to me for anything, please feel free. I really thank you all for your interest, and I congratulate you on taking the time. I think we have one of the best programs, literally in all those ways that you could find anywhere. And I think every stop in our rotations is the same sort of thing. You're going to be met with really excellent people. I've been impressed personally as a faculty member from the day that I got here by the camaraderie, the court esprit, and the sense of work hard, play hard that our residents bring. And I think they're the best ones to talk to, you know, and if they pull you aside and say, I'm super miserable, don't come here, I would listen, but I'll also be stunned if that happens, because I doubt that would be the case. Yep, Noel just put up in the chat box. Thanks, Noel. That's my email at the VA. I've got an email at the university as well. You can track me down easily. Dr. Sawyer, Dr. Ballinland, any of us. Little questions, big questions, anything at all. Where to ski, where to eat, you know, when can you visit? Those kind of things, we'd all be delighted to talk with you. And tell me if I'm mistaken, Noel, if you're there, or Ty, but I'm gonna think that this is where we as the faculty pull out and leave the residents to kind of field a couple other questions. Does that sound about right?
Yeah, I think that'd be great. Nadia gave you a thing to say you're the best resources for food recommendations.
It's tough to keep the weight on out here, but I succeed.
Yeah. So no, that was great. Thank you, Granville, Mark, Eric, everyone for being on the phone and doing this presentation. We really appreciate it. Actually gets me excited and thinks that maybe I should rethink my career path. But anyway, no, thank you very much, you guys. We really appreciate all you do for our educational service of our medical students as well as our residents. And with that, we'll let maybe Valeska kind of lead any other, you know, insider info questions that we aren't privileged to. So.
Thanks again, guys.